Let's talk wisdom teeth, Dr. Seibach. What is it about wisdom teeth which, makes everybody jumping, worried, making jokes? Some seem to have it, some don't even seem to have it. Is it one of those things which the body really doesn't need? And tell us about wisdom teeth.
Well, wisdom teeth are a lot of times they don't have space to come out, so they end up causing periodontal disease. They end up causing food traps, odor in the mouth, jaw aches, infections, and so on. They tend to be very difficult to clean. So therefore, usually the criteria when you have a wisdom tooth and it's not in a good position, well, we tend to recommend for them to be extracted.
And is a wisdom tooth extraction really so? I mean, people fear wisdom tooth extractions more than they fear hip surgery these days. Why is that?
Well, obviously, because it's way far back in the mouth, they tend to be a little bit more difficult than a tooth that's in the front of the mouth. They tend to be overlapped by bone and so on. So it's really simple. It's not like as what people make it out to be. But it's obviously with the hands of a correct surgeon, it's not a problem at all.
So it's probably more like the whole field of dentistry and maybe even the whole field of medicine, but surely dentistry where we're still stuck at the old time. As I said, my doctor used to poke the teeth, and if you got an injection, I mean, it was like a pencil. It was like the hole where the thing came out was like huge. It was like a pipe, not now where it's very thin. So basically technology changed. So simply it's not any more painful for purpose do a root canal. Same thing. It probably used to be more painful and people still stuck on it. Is that probably more like what it is, the horror stories that come from 20, 30, 40 years ago?
Absolutely. Dentistry nowadays is not what it used to be. There's a lot of more instruments and tools and diagnostic tools that we use to make your experience a much comfortable experience.
Great. Well, all right. Thank you very much.